My name is Karim Ladha. I'm one of the anesthesiologists and clinician scientists at St. Mike's.
I'm Venkat Bhat. I'm a psychiatrist and director of the interventional psychiatry program at St. Mike's Hospital. So there are two things which I liked growing up. One was stories, and the other was trying to understand how the brain does it. I had difficulty choosing between neurology and psychiatry, but it was really the storyline which made me decide to move towards psychiatry.
If you talk to my wife, she says I went into anesthesia because I don't like to talk to people. And traditionally, anesthesiologists do want to keep their patients asleep. So working with patients who have depression, it's a whole new world for an anesthesiologist to be in. In Canada, we are the only hospital program where anesthesia and psychiatry work together to deliver these novel treatments. And so for us, what we want to do is try and find new drugs to treat chronic pain and depression. So one of the things that we particularly want to look at is long COVID related to neurologic diseases such as depression, brain fog, fatigue. What we found is that there's a particular receptor that's implicated in this called glutamate. Now, as an anesthesiologist, that's a receptor we target all the time with a particular drug called ketamine. And what we found is that at lower doses, it actually affects people like with their pain and their depression in ways that we never thought it would.
So if I wasn't a doctor, I would be writing stories. I would be a novelist.
If I wasn't a doctor, I think I'd open a restaurant, Karim's Taco and Barbecue Stop.
I would describe Karim as collaborative and always having the patient's interests at heart.
Mine's not going to be as nice, though, I think. My one word for Venkat is stubborn, but I mean that in a positive way because he never gives up.
If we show that ketamine has efficacy in neuro-COVID, it can be scaled up and could be deployed right away worldwide.